Okay, good afternoon, ladies and gentlemen. So today is our another day for life. Okay, so today's is very interesting because we are bringing up a new and also another level of updates. Okay, regarding slimming. Okay, so today I will explain on this particular topic called why methods that you use before for slimming are becoming not effective when you are getting older. Okay, you don't say older lah, but probably when you tried certain techniques of slimming during younger time, like let's say you try certain products of diet replacement or sort of certain pills, yeah, it sort of like used to be effective to help you to reduce certain kilos or weight and you feel okay. But then when you are getting sort of like grow up, okay, you probably gain weight again. Then when you gain weight and you try to use those method again as you used before, but then you find that it's not effective anymore. Okay. So any particular reasons for it? Okay. So today, okay, I'm Dr. Jeff here in Revival Clinic. I would like to explain on this particular reason, okay, why the methods that you used before for slimming is becoming not effective nowadays. All right. So ladies and gentlemen, welcome everyone. Today we have a slides here, so let's start. Okay, so basically, for the reasons why the methods that you use to slim down before becomes not effective is because of these four particular reasons. We call it hormones, okay, due to aging, yeah, changes of hormones due to aging, or you have a condition we call it metabolism malalignment. And number three, where you have high insulin resistance, even up to the level where your pancreas become very weak. Pancreas is the organ that produces insulin. So if you have very high insulin resistance, your pancreas are exhausted and become very weak. Is also another reason why when you try to use those method that you slim down before become not effective. Okay, and another new particular information that updates for every one of you is we call it weak mitochondria in the cells. Okay, what is it? I will explain one by one. All right. So okay, if you have any questions, I welcome every one of you to put in your questions and I will explain through and answer your questions. Okay. So, ladies and gentlemen, first, the reason why you have this issue where you starting to feel not effectively unable to reduce your body weight and you can't effectively use the same method that you used before to slim down again now is because when you are having hormone aging. Okay, so hormone aging actually reduces our basal metabolism rate. So very fundamental cause. It causes your basal metabolism rate to reduce, and then your body start to age, your cellular function become weaker and slower. Then those methods that you used before, like for example the appetite control pill or the sort of like sugar drainage pill, yeah, or sort of like slimming diet replacement kind of diet. Okay, so those are not effective anymore. Okay, because your cells are aging, your hormones are aging, and your metabolism rate is slower. Okay, so okay, second is another cause is we call it metabolism malalignment. What does it mean? Okay, in our body, our metabolism is not simply just equivalent to like one plus one equals to B. What does it mean? Metabolism is not just simply saying that your metabolism equivalent to anabolism and catabolism means build up and burn off. Okay, metabolism actually involve more complex processes. So, but malalignment means your anabolism sometimes is not in one direction but multiple direction where your body gain fat easier, your body build fat easier, your muscle build slower. So in this all combination, it makes a malalignment. Okay, so metabolism is a condition where it's actually one of the earliest point when you're starting to have these metabolic diseases where diabetes, cholesterol, uric acid, gout issue, or hypertension or even the stroke kind of risk. Okay, so metabolism alignment is a simpler word that we describe. Okay, but actually there are many medical terms, okay, to describe this issue. But metabolism alignment is the simplest way to at least explain on this character, saying that your body, okay, is not metabolizing at the normal method, but there are a lot of a lot of a different angle of metabolism where you build fats easier or faster. Okay, so this is one. And another reason is because of high insulin resistance. High insulin resistance is where your body, whenever you consume sugar, your body will sense it and respond to produce insulin to balance the sugar back. But the thing is, when your insulin become resistant, means it's not functioning in a proper or optimal way. So that give a stress workload to the pancreas, which is the organ that produce insulin, to work even harder. And up to one point, when the duration is long term, your pancreas are becoming weaker and weaker and weaker and weaker, almost at the margin of failure. Okay, so this is like towards nearer to the diabetes risk already or level already. So when you have a difficulty to slim down, even though you try diet method, exercise or slimming pill, things like that, but you still couldn't slim down, probably you are having this kind of condition in the body. All right, so this is one of the reason. And number 4 is another condition, we call it weak mitochondrion in the cell. Means what? Okay, mitochondrion is a kind of energy generating generator in the cells. Our cells has a nucleus, and the cells perform by producing protein from a nucleus, and the performance of the cells needs energy. So the cells will actually generate energy, okay, from this mitochondrion, okay, for the function of the cells. So mitochondrion is very important. If the energy source is weak, then the cell is not functioning properly, then the metabolism of the cell is weaker. So for example, if the cells in the gut membrane is weak because of poor mitochondrion, so then your cells lining will be weak, right? If your cells in the heart is weak in the mitochondrion, then your heart is unable to work appropriately or optimally. When your cells in the muscles is weak, that's why you don't have a very strong muscles. Whenever you do exercise, you can't really pick up the strength. When your cells in the immune system, lymphatic system, your bone marrows are weak, so the mitochondrion in the cells are weak, so the immune system will become weaker. So this is one of the particular finding that nowadays a lot of anti-aging or preventive medicine to regain your youthness are focusing on how to sustain the mitochondrial health in the cells to give you a better care of your body. So this is also another particular reason when your mitochondrion is weak in the cells, okay, usually due to certain particular infection or nutritional lacking or emotional reason, it makes your cells to be unable to work optimally, and in the combination of consequences, it become your body would not able to respond easily to any particular supplement as well as any slimming medications or treatment. All right, so this is the reason. Okay, so welcome to Slimming in our Revival Clinic. Okay, we have almost 10 years and above experience in treating all sort of slimming issue. So our direction of treatment is to slim down everyone accordingly to different individual or respective condition of the person. We do blood tests, we examine visceral fat all thoroughly, and also we changes the lifestyle of patients in an acceptable way. And also we do slimming sculpture body machines like Cool Sculpting, M-Sculpt, and many more. Okay, and our ultimate goals for everyone is to achieve a healthier lifestyle. We'll be able to achieve good body shapes, and also most importantly is to prevent any relapses of the body weight. Okay, because after you've gone through so much of suffer or so much of effort, okay, to slim down and gain the nice body shape that you wish to have, we would like to make sure that you also achieving a kind of stable body weight characters where you will be able to maintain it on your own without any dependence on any medications or anything. Then you will not need to worry about rebounds of your body weight. All right. So, ladies and gentlemen, if you have any particular questions, I welcome again for anyone who just joined us. Yeah, Jenny, so I saw Jenny's here. Okay. Yeah. So welcome to our live show. Okay. So okay, let's continue. Of course, anyhow, any fundamental slimming methods, it goes back to diet. Okay. Simplest way to choose a diet is always try to choose high fiber carbohydrates and high dense fruits or whole foods. Okay, means you don't really blends or chops, or try to take the fruits as original as possible, keep the fiber, keep the nutrients, try to avoid overcooking, things like that. Okay, and always take lean protein. Okay, you can take protein shake or lean protein like chicken breast, salmon, fish, things like that. Okay, so high fiber, okay, carbohydrate, lean protein, and compact, okay, or dense nutrition foods, okay, and whole foods. So one of the common techniques that we always recommend people who can practice intermittent fasting will be good, because intermittent fasting not only for slimming, but it actually helps our body to really recover, especially our particular organ called pancreas. So when you let the body rest without sugar, in particular, so actually your pancreas can rest adequately and healthily. At least it can reverse your insulin resistance and also reverse your pancreas functioning, and as well as reducing the accumulation of visceral fat. All right. So this is another thing, and also intermittent fasting is very helpful to let a person have a stronger immune system, and also improve the gut health, detoxify the guts, and also improve our brain and memories. Okay, so ketogenic diet is also another common methods that people be practicing. Ketogenic diet is actually a way of diet choices to stimulate the own ability of our body to perform ketogenic. Means our body, when we are starving from sugar, our body will automatically produce this kind of energy source called ketone body. So this source is actually burning down all the sugar or sort of fats in the body. So meaning to say, if you stop supplying your body with sugar and just giving your body any particular fat-derived energy or protein-based energy, then your body will not have any fast fuels to burn. So your body will need to turn the direction of fuel burning from the own fats. Okay, so this is the techniques of using this particular ability of our body to let the body burn fat on its own. Okay, so ketogenic diet is one of common techniques people be practicing, and is if you would like to practice, make sure you understand it well, and usually you can PM us to know more. Then you can do it if you can tolerate all those choices of food, and it is tolerable for many people lah. Okay. So Amni Ramdan is asking, Dr. Metabolism still can speed up after 5 years old. Okay, of course, when our metabolism becoming slower when we age, it definitely can be speed up with some supplementation. Then later on I will explain when we reach that segment. Okay. Thank you for your questions, Amni Ramdan. Okay. So, okay, again, so intermittent fasting, ketogenic diet is a fundamental way. If you can modify, you can always start practicing this, because you need to start. The reason is because if we treat you with all this medical treatment, and when you achieve good weight reduction, you need at least an intermittent fasting practice lifestyle to maintain your body weight easily. Right? So sometimes if you get used to ketogenic, you can even practice it on and off to keep your weight even better control. Okay. So, okay, another particular factor, as we mentioned just now, is insulin resistance and pancreas weakness. Is one of a very common factor that causes a lot of people gain weight and difficulty to reduce weight. It's actually where your insulin resistance is actually subconsciously becoming resistant until you do not know that you are actually facing a condition called pancreas weakness or pancreas fatigue. So this is a character causes a lot of people unable to slim down by using intermittent fasting or ketogenic diet anymore, right? So how to treat this particular condition? So basically, you need to practice intermittent fasting still, but usually we also combine with a medication called metformin to sensitize your insulin, yeah, during your diet timing. And you also can choose nowadays. Recently, there are new item or new medication in the market called Saxenda, okay, or another similarity to the product, okay. We call it semaglutide, okay. It's come in a, okay, I'm not sure about the brand name here, but basically Saxenda is liraglutide and semaglutide is another like family name of it. So totally two different medication, but it works by reducing your craving for sugar and also increases, okay, your appetite. Satiety means you feel full after you taking medication, you feel full faster, you don't feel hungry so easily. So actually it helps your body to sustain, okay, a better level of your sugar by helping, okay, your body to balance, okay, in terms of your sugar and insulin resistant character. All right, but this is still a medication, okay. We do it in a we will consider it in a combination or sort of a supplementary way if necessary to break through. But anyhow, intermittent fasting is still a fundamental. With metformin is still a fundamental thing. Okay, so of course, knowing your metabolism is very important because if you are getting older, like Hamdi Randan is asking, yeah, when your metabolism is slower, sometimes when you exercise also you can't really feel energetic. Okay, it's because few reasons your hormone probably dropping or aging, and also your mitochondrial health is actually getting weaker. So this causes you to be very difficult to pick up any exercise. So without exercise, you can't build muscle, you can't actually energize easily. Your metabolism on the baseline will be always on the lower side. Okay. But anyhow, if you would like to pick up some exercise, there are three categories of exercise. First is weight training, second is cardio training, number three is core muscle training. For those who are like on the overweight obesity side, not advisable for you to carry on to weight training straight away. But funny to say, when we go to the gym room, those obese people usually, okay, when they're slimming, they will always do a weight training on the chest, on the biceps, and try to things like that. Okay, it's not making joke of them. Okay, sorry about that, but it's still because the mindset is not correct. The understanding should be when you are starting to slim down, your muscle is very weak, your basal metabolism rate is very low, your core muscle is very low, so you couldn't really able to train up. You may injure your muscle and injure your joint very easily. So what you rather need to focus is cardio training, means do something that actually sweats, sweats. Okay, so there's something actually aerobic, okay, which oxygenated well. So like running, like swimming, like jogging, like cycling, yeah, or treadmills, okay. And then together with core muscle training. Don't do cardio training alone because cardio training it burns your fat, you also burn your muscle. So you need to have a strong core muscle. Core muscle is muscle on your back, on your buttock, on your thigh, and your abdomen. Those are the big muscle, and this muscle when you train it up, it give you a very strong core for you to be ready to go up to weight training. So when you are starting from an obese condition, you should do cardio training and core muscle training. When you are becoming stronger, then you slowly turn into weight training or combine with some weight training, but keep your core muscle training together. All right. So then you will be able to pick up your exercise easier. Very important, if you're able to pick up your muscles well, your core muscle training is good, your weight training is also picking up, your muscle bulk when it's building up, your metabolism, especially the BMR or basal metabolism rate, will be able to pick up. It gives you advantage where if you do exercise regularly, it gives you a very good sort of like fuel burning engine. So you keep on burning throughout the whole day. It means you are able to enjoy the food better. You won't gain weight so easily, right? Isn't it a good thing? All right. So, okay, but anyhow, if you pick up exercise, you do it by your body metabolism still very low, you still feel very tired, lethargy, then probably your thyroid hormone is becoming older. One of the significant or common thing that we always see. So it can happen in even a young teenage or even young person during their 20s. Okay, so thyroid hormone, probably when you do a blood test, it could be normal. Doctor may tell normal, but what rather more important is whether it is optimum. Normal doesn't mean optimum. Okay, so optimum where does it mean? It means that your body really have a good level of the thyroid hormone, that your metabolism is on the better side, a good side, rather than just okay average level. All right, so optimum is very important. So usually if your metabolism rate is very low, we can do a blood test to check the level, and then if your body needs an optimum metabolism rate, then you can optimize the level of your thyroid hormones by using a bioidentical thyroid supplementation. Okay, of course another challenges is when a ladies, especially ladies, if you hear this, probably this may concern you more. If you are reaching the menopausal age, probably about 45 years old and above, or even like 50, 60 years old, of course, these menopausal changes will also affected your condition a lot. Why? Because when you menopause, the hormone changes, especially the female hormone side, will makes your metabolism deranged even more. Okay, so there are a lot of slowdown in the cells functioning, and then you will feel that your body gain weight, even lose weight very difficult, and also gain weight easier. And this is another timing or common cause why when you are menopausing, you try to use back the previous method that you used to slim down, then you feel that it's becoming not effective anymore. So the reason is menopausal and part of an aging process. Okay, but of course, if you do have this particular issue, we can also supplement your body with appropriate bioidentical hormones to balance your hormones, to support your hormones, so that you will be able to still reduce your body weight throughout this period of time. Okay. Okay, another common factor that we always see is people who have high visceral fat. Basically, it's because metabolism malalignment. So metabolism malalignment can be assessed or can be determined through a visceral fat. You can also through the gut health. You can also assess through the body inflammation. There are certain blood tests to determine that. So if you have metabolism malalignment, definitely you will be higher chance to fail all the previous technique that you used to slim down when you were younger. Yeah, because your metabolism is malaligned, it doesn't respond accordingly or supposedly. So that's why your body, no matter how you keep the diet, you control your diet, you do exercise, but the fat just doesn't go away because the fat just accumulate by itself. There's a saying that, or you don't eat, also you gain weight, right? When a person gain weight or become obese up to one level, the body will gain weight automatically without even eating. Even you eat the air, also become fat. Because why? The metabolism malaligned. So how to tackle this? Okay, so metabolism malaligned usually, okay, I come back to this. We need to treat the body inflammation, we need to treat the gut health, and also we need to treat the visceral fat. Okay, so you can call us or PM us to know more how we treat this metabolism malalignment. Right. So very important is if you treat all these fundamental root cause of your obesity issue, definitely we will be able to break through more confidently. Means you will be able to achieve weight reduction in a sure way, and also to achieve a good sort of a stable weight reduction, where your weight reduction when it's achieved in the optimum weight, then your metabolism is better aligned, your insulin resistance is healthier, your lesser, I mean your pancreas is healthier, and then of course your metabolism is better, yeah? Your muscle pick up better, your exercise habits also better. You just need to maintain with intermittent fasting or sometimes some exercise. Good enough, right? So things like that is what we are going to achieve. Okay. So another common factor that a person face when they have a difficulty to slim down is because of this mitochondrial health. Okay, it may be related with stem cells. Okay, a lot of people talk about stem cell, but stem cell is rather a broad term or broad condition. It may has a lot of function, but today I would like to discuss a bit more detail or precise called mitochondrial health. So as I mentioned just now, mitochondrial health is where is a kind of energy generator in the cells. Okay, so the mitochondria is a energy generator in the cell to produce energy for the cell to function, to survive, to work, to perform, right? So, but the mitochondria can be weaker due to a lot of reasons. Most of the time, it can be due to a kind of stress, okay, neurotransmitter effect, hormone effect, infection, poor gut issue, okay, sort of like if you have high inflammation in the body, okay. So all these can weaken the mitochondrial health, and even though you are not old, okay, but your functions of the cells as in like old, okay, because the cells need energy, but energy is not producing, so the cell is not producing that, it's not performing that, then the cell is like old cell, okay. So how to improve or target this particular mitochondrial health means how to energize your generator, the energy generator. Okay, there are certain particular supplements or ingredients which already proven that can help the mitochondria to become healthier and to sustain the health of the mitochondria. Okay, very important here is the understanding is if you don't let the mitochondria improve or heal, it will also dies off, and the mitochondria in the cell will become lesser and lesser over time. Your cells may not contain only one or two, it may contain thousands or millions of mitochondria. But the thing is, it will become lesser if you don't heal the mitochondria. Because mitochondria contains some DNA inside it. So when your DNA damage inside the mitochondria, then it will dies off. And the dies off of a mitochondria becoming more significant, the cells also become totally aged and functionless. So how to recover the mitochondria? So we need supplement like curcumin, is a kind of like derivatives from turmeric. Okay. Another supplement is NAD plus or NMN, is a kind of derivatives of vitamin B3. Astaxanthin, okay, serotonin, coenzyme Q10, okay, natural oxide derivatives like L-arginine, a kind of amino acid. All these are very, all these are sort of like have its different aspects of function, but all targeting focus on mitochondrial improvement or sort of like generating. Okay, so these are the things. It comes in oral supplements, some of it, some come in a sort of like powder or pill, some come in a IV drip or sort of like. But I think Malaysia still don't have, but basically mostly are oral supplementation. Okay, but taking this oral supplementation alone may not sometimes work very fast. One of our latest technology here in Revival Clinic is what we call it. OnDaMed is a wave medical technologies. So it fine-tune the blockage of your frequencies in the body at different parts of the body. We determine it, we justify it, okay, then we break the blockage and then let your flow in the body generates. Then when you take supplement the mitochondria to improve your or support the mitochondria, then the energy flow faster, then you will heal your body easier and better. All right. So beside that, also technologies like exosome, stem cells, it comes in the sort of like picture. Why? Because stem cells or the exosome, which is a derivative from the stem cells, okay, it actually generates certain kind of protein, right, to stimulate our cells to heal. It's a message. Stem cell will produce exosome, and the exosome is a message from the stem cells to heal, because stem cells will message or sort of like stimulates the other cells to heal. Okay, so exosome is the message from a stem cell. So when the exosome deliver the message from a stem cell to our body cells, the cell will start healing. Okay, So when it heals, it will generate mitochondria, it will generate our healing, okay, in the body. All right. So these are the things, okay, ladies and gentlemen. Thank you, and almost coming to the end. Keeping it short, concise, okay. So in summary, to say, okay, if you have any difficulty to slim down, and where you try to use the previous technique of slimming, like appetite suppressant or diet control, diet control pill, or sort of like sugar or fat control pill, or take fiber or any replacement meal, and it's not functioning anymore. Remember this, there are four particular reasons. First is because your hormone aging. Second is because of the what is it? Okay, so it's because of your anyone can guess? Okay, so just now, okay, mentioned insulin resistant. Okay, second. Okay, yeah, good guess. So number 3, okay, is your the what else? Okay, maybe I can show you back. Okay, so basically is the insulin resistant malalignment of your metabolism. Okay, so again, so when you have difficulty to slim down and those methods that you used before not effective anymore, so probably your body is having aging of your hormone and metabolism malalignment and insulin resistant or pancreas weakness. The last one is the weak mitochondrial function in the cells. All right. So let's practice. Okay, our aim is to improve your body weight issue, achieving an optimum weight reduction, prevent rebounds of your body weight, and let you able to really understand what is your body own character, how you can really take care of your health and your weight in a confident way. And yeah, that's it for Revival Clinic. So if you like to know more about your own problems, okay, feel free to call us, all right, or contact us through this phone number 017-781-5237. Yeah, and we would like to see you. I look forward to see you and help you to achieve a healthier and more beautiful lifestyle. All right. So thank you very much, and I see you again on next week. Bye bye.